everyone. I'm Dr. Megan McNeil. I'm a clinical and forensic psychologist. Did you know cannabis use can lead to schizophrenia? I first encountered this in my work in 2017 when I evaluated a man who believed he could control the wind with his mind. There was no history of mental illness in his family and no significant drug use other than the fact he had started smoking marijuana in his teenage years. He smoked on a daily basis, starting in his teens until his mid to late 20s. In his mid-20s, the delusions started, first with the belief he could control the wind. Over the years, the delusions got worse. His girlfriend told me he would confront random strangers because he believed they were following him. He dismantled their television because he thought the government had implanted a camera and they were trying to record him because they wanted to study him and his special powers. He thought people were coming to the house to rape his girlfriend while he was away at work. His girlfriend became increasingly concerned, and she tried to get him mental health services. He was diagnosed with schizophrenia, prescribed antipsychotic medications, which he took inconsistently. After 6 years of being with him, his girlfriend finally ended the relationship, and he moved out and essentially lived on the streets. Within months of being on the streets, this client robbed a store because he was convinced the CIA was close to capturing him so they could study him, and he needed money to flee the city. By the time I saw this client, he was in his mid-30s. He hadn't used cannabis in years, but the delusions were still strong. At first, I was skeptical about the role of cannabis because my education about marijuana is that it doesn't cause this kind of psychosis. Certainly not the way cocaine or methamphetamine or LSD might. But in 2016, some research came out showing that high concentration THC use can lead to psychotic breaks in people who have no family history of mental illness. Also, it can cause low-grade schizophrenia-like symptoms, for example, paranoid and grandiose delusions, that for some people don't go away even after they stop using the cannabis. This is not the marijuana from the 70s and 80s. The potency of THC is around 10 times stronger than it used to be, and concentration levels can be 90 to 95% in some strains. Also, what's happening is that the THC is being separated from the CBD, which is a problem because research is showing that CBD actually protects the brain from the psychotropic properties of the THC. The CBD essentially has antipsychotic properties. So we've increased the potency of the THC while simultaneously removing the protective component, the CBD, which makes the brain more vulnerable to lasting psychosis. Over the years, I've been seeing more clients with cannabis-induced psychosis. For example, a 50-year-old man with no history of mental health issues. He was a middle-class guy. He had worked in business for 30 years. He was stable, married, had a couple of children. Then he started using THC to treat back pain. He had a medical marijuana card. His physician essentially signed off on it. And so he started dabbing shatter oil, which is high concentration THC. Within months, he became delusional, telling people there was a Nazi invasion and that he was a prisoner of war. He had never been in the military. He ultimately beat an elderly man nearly to death in a parking lot because he believed the elderly man was part of the Nazi invasion, trying to capture him to then make him a prisoner of war and torture him. This client was misdiagnosed with bipolar disorder, and he was sent to the state hospital. He's been there for years, not taking any kind of medication, and he's been stable. He's waiting for his release. If you like these videos and you want me to keep uploading them, please hit like or subscribe. I have full videos on YouTube and training videos on Substack. Thanks for watching.